everybody, my name is Emma, and today we're focusing on an essential aspect of recovery and care, passive range of motion exercises. So what is passive range of motion mean? Passive range of motion occurs when an outside force causes the movement of a joint without any effort from the patient. This usually takes the joint through its maximum possible range of motion. You might be wondering, why is passive range of motion important? Long-term immobility can cause serious problems like muscle loss, pressure sores, and painful contractures. Passive range of motion exercises are vital for maintaining joint mobility, improved blood flow, providing nutrition to cartilage, and preventing those contractures that can interfere with daily life. We typically perform passive range of motion when the patient is unable to move the body or the part themselves.
Hi, my name is Isabella, and before we start today, remember our key tips for patient comfort. Position the patient comfortably, move slowly and gently, and stop immediately if there's any pain, as well as being sure you are comfortable by lifting the bed up to waist height to avoid any back strain. Before touching the patient, make sure to verbalize that you have washed your hands. We'll be demonstrating the shoulder, knee, hip, elbow, and fingers. Hi, my name is Isabella, and I'll be doing your passive range of motion exercises today. I've washed my hands. First, we'll start with the shoulder. By doing 3 sets of exercises, we'll support the patient's wrist and elbow. Flexion, extension, flexion, extension, flexion, extension. Then we'll do abduction and adduction. Abduction, adduction, abduction, adduction, abduction, adduction. Then we'll align the elbow with the shoulder, creating a 90-degree angle with the elbow. Internal rotation, external rotation. Internal rotation, external rotation. Internal rotation, external rotation. Then we'll move on to the elbow. We'll support the patient's elbow and the wrist, leading the wrist up to her shoulder. Flexion, extension, flexion, extension, flexion, extension. Then we'll move on to the fingers, doing abduction and adduction for each finger. Abduction, adduction, abduction, adduction, abduction, adduction. Abduction, adduction, abduction, adduction, abduction, adduction. Abduction, adduction, abduction, adduction, abduction, adduction. Then we'll curl the fingers into a ball, flexion, roll them all the way back out so they're straight. Extension, flexion, extension, flexion, extension, flexion, extension. Then we'll move on to the hips. We'll support the patient's leg and knee, bending the knee toward flexion, extension, flexion, extension, flexion, extension. Then we'll do abduction and adduction. Abduction, adduction, abduction, adduction, abduction, adduction. Then we'll support the patient's leg and under the patient's heel for internal and external rotation. Internal rotation, external rotation. Internal rotation, external rotation. Internal rotation, external rotation. Finally, the knee. We'll support the patient's legs by placing one hand under the knee and the other hand under their ankle. With the hip stable, we'll gently bend the leg towards their body. Flexion, extension. Flexion, extension. Flexion, extension.
Hi, my name is Ava.
Hi, my name is Amy. Let's talk about some common mistakes we need to avoid. The number one mistake is forcing the joint past its normal range of motion or not stopping when the patient reports pain. Remember, this is passive, not painful. Avoid moving too quickly or using jerky movements. All movements should be smooth and controlled. It is also very important to use the correct body plane to avoid unnecessary strain on the joint.
Always ensure you're properly supporting the limb and stabilizing the correct points above the joint you're moving. Don't neglect to consider the position of other joints that cross the same muscle. For example, moving the hip requires you to be mindful of the knee position.
So to recap, here are top tips for patient comfort and safety.
Move slowly and gently.
Use a firm but gentle grasp to support the joints and limbs.
Always ask about pain and watch for any nonverbal signs of discomfort. If pain occurs, stop immediately and reassess.
Passive range of motion exercises are a cornerstone of preventing complications from immobility, By using proper techniques, slow, supported, and pain-free, you can help maintain the joint health and comfort the patient.
Thanks for watching! If you found this helpful, please like and subscribe for more educational content. And remember, always consult with a healthcare professional before performing these exercises, especially on patients with complex medical needs. See you next time!